I felt 75% better on the first day. The second day was even better yet. And the third day I thought, hallelujah, here I go.
The best thing about MUA, it gives you your life back.
For me, the importance of it was that I now do not have the pain and I can live a much better life.
These chronic pain sufferers and thousands like them across the nation have one thing in common. They've discovered the tremendous health benefits that can be restored by the procedure known as manipulation under anesthesia. Manipulation under anesthesia is exactly what it sounds like. After medical clearance, the patient is lightly anesthetized to achieve total relaxation. Then adjustments and stretching movements which would normally be too painful to even consider are easily, painlessly, and quickly accomplished. For more and more chiropractic patients who are not finding relief through conventional treatments and other invasive procedures such as surgery, MUA, combined with consistent but simple post-procedure treatment and exercise, can eliminate or greatly reduce pain and restore or greatly improve range of motion. MUA is neither new nor experimental. It's actually been practiced since the late 1930s and used by osteopathic physicians and orthopedic surgeons for many years as a proven form of treatment. During the past 8 years, interest in MUA has greatly increased thanks to tremendous advances in anesthesiology. Today, MUA is a multidisciplinary outpatient procedure that takes place in a controlled hospital or ambulatory surgical setting, usually over the course of 1 to 3 days. Using specialized chiropractic techniques supported by the expertise of MDs, RNs, anesthesiologists, and physical therapists, MUA achieves maximum results for qualified patients. MUA can be a valuable procedure for people with chronic neck, back, and joint problems, conditions caused by long-term disabilities, accidents, and injuries that have not been responsive to conventional treatment. But MUA is not for everybody. MUA achieves results where other treatments fail because it allows your caregivers to adjust the bones and muscles, the therapy of choice, without the usual resistance. Twilight sedation allows you to be responsive but not apprehensive. Manipulations are completed gently and without the patient's usual pain-trained psychological resistance. Fibrotic adhesions, which limit range of motion and contribute to pain, are altered. Muscles are stretched. Collagen fibers are remodeled to eliminate or reduce restriction. Pain and discomfort are decreased. Post-procedure care is one of the most important parts of the MUA procedure and makes it truly effective. The therapy begins immediately, the same day after each MUA procedure is completed. At this time, the patient visits the chiropractor's office and undergoes a combination of stretching exercises, cryotherapy, and electrical stimulation to eliminate or reduce soreness. The patient then returns home to rest.
I'd been wearing a collar a year previously to that.
I always had this dull burning feeling. And then I had a car accident which made it even worse to where I couldn't even lay down.
And I constantly had a burning pain, and it just never would go away, even with treatment. And after the MUA, it was gone.
But I always had this constant ache in the small of my back. Time progressed and things really weren't getting better.
As a chronic pain sufferer, isn't it time you considered manipulation under anesthesia?